President Cyril Ramaphosa has introduced tougher lockdown measures in South Africa as the national COVID-19 cases spiked to over 276,000. They include the reintroduction of the alcohol ban, a nationwide curfew, and also limits to the capacity on public transport. To unpack the implications of the latest risk-adjusted COVID-19 measures on the economy, I chat to Busi Mavuso, who is the CEO of Business Leadership South Africa, and also Dr. Devorah Leigh Weinberg from Baragwanath Hospital. Ladies, thanks so much for your time. Busi, good to catch up with you. Good to see that you're still doing well. What is Business Leadership South Africa's position and reaction to President Ramaphosa's latest pronouncements on COVID-19 and trying to manage the health crisis as well as the economic one?
So I think as much as we understand the serious predicament that government finds itself in at the moment in terms of trying to balance both health and the economic aspects of the economy. But if you look at the implications of this ban, I think they are much more dire, especially if you consider the fact that the economy is already ailing. If you consider the fact that we're already sitting in a depressed economy, if you consider the fact that the finance minister is already saying that this country could be facing a sovereign debt crisis in the next, 3 years. This is an industry that supports about 1 million jobs. This is an industry that contributes 10% of tax revenues. It is an industry that generates about 6 billion in terms of export earnings. It is an industry that supports about 35,000 township-based businesses. So you therefore see how, the economic impact is going to be. And I would have thought that given this scale, I think there should have been more thought that should have been given to this decision. And I think the government is at fault on this one by not having consulted business before they actually went ahead and implemented this decision, because business was totally blindsided. I think if there would have been a conversation around how do we deal with this issue that we're facing, we could have brought in suggestions and proposed interventions in terms of how we can actually deal with this, rather than how they've actually gone about it. So I don't support the decision at all.
Yeah. Interesting thing there that business wasn't consulted, Busi, but of course this is also an industry that has led to the number of beds that should be going to patients who have got COVID-19 or in need of that treatment, not really being able to access them because of the increase in the number of alcohol-related incidences that hospitals are seeing. And Dr. Weinberg, perhaps you can fill us in here on the change that you did experience in Baragwanath Hospital in Soweto, which is the largest township in South Africa, but it's also the hotspot for COVID-19 here in Gauteng. What change did you see from when the lockdown initially began in March, and then when the lockdown was eased in June, and particularly with level 3 allowing the consumption and the sales of alcohol again? Describe to us what you saw in the hospital.
Hi, good evening. So I think we need to appreciate that Baragwanath is one of the busiest trauma units in the country, and we see on average 2,500 patients a month there, with significant number of admissions, about 400 admissions a month, as well as about 30 severely injured patients being admitted to ICU a month. With level 5 lockdown, we're still analyzing our data properly, but it looks like we're seeing about a 75% decrease of patients that came into Baragwanath trauma unit during this period, and a 50% reduction in the number of patients that went to ICU, which practically means that the number of patients being admitted and using the resources in the hospital will obviously significantly decrease during this period. And once the level 3 lockdown started and alcohol was once again for sale, the numbers increased significantly back towards the normal numbers that we were seeing before the lockdown started. I think what's important to realize is that
a bit further on that, but all right, Dr. Weinberg, we'll come to you again in just a moment. We do have another individual who's joining in on this conversation, Lucky Ntimane, who is a convener for the National Liquor Traders Council also weighing in on the debate here. Lucky, thanks so much for your time. We've just been speaking with Business Leadership South Africa, and they say that they were blindsided by some of the announcements that the president made yesterday, particularly the reintroduction of the alcohol ban. I'm sure on one part of that argument you understand how or why this was done. We've seen an increase in alcohol-related trauma cases in the hospital, taking the beds of people who need it the most. But on the other hand, this is surely going to impact the industry and hurt it quite significantly. Just your reaction to what the president has announced.
Good evening, and good evening to your viewers as well. Look, we were caught offside. We really didn't expect, the decision that the government arrived at, especially given that, we have been writing to government, wanting to have the conversation with them with regards to how can we best look for solutions that will not compromise the health system, but will also preserve the livelihood of not only our traders, but also the society at large that they support. And, we didn't get any response. And a couple of days after, and then announcement from the president, so we're really shocked and surprised that, after reaching out to them, they decided that, we're going to make this public, we're not going to consult, we're just going to ban alcohol, as it were. So it's a total shutdown of alcohol indefinitely, which is a problem.
Lucky, I'm interested. What were some of the ideas that the industry had in how to manage things better? Already we had a reduced number of days in which alcohol was being sold and reduced number of hours. What were further proposals coming from the industry as to how to manage the alcohol situation and prevent it from weighing on the health system further?
So it was actually looking at the number of days and also the operating hours, as it were, but also to look at the bigger issue that I think we as a country have been avoiding for a long time, the issue of behavioral shift of our consumers. Because if you look at the report and also the reality on the ground, there hasn't been any issue with regards to taverns not adhering to COVID-19 regulations or just basic laws that govern their liquor licensing, and also independent liquors. Everyone came to the party and they were complying. Our traders, they had sanitizers, they had masks. Consumers that were coming in without wearing a mask were not allowed in. There was 1.5 meter distance, social distancing as well. So in terms of the trading environment, that was well taken care of. And we didn't have any issue. The issue that we're dealing with is around consumers, people that are consuming alcohol irresponsibly. And we need to acknowledge that it is a problem that we as a country are facing. And we cannot postpone fixing this problem to post-COVID. It's facing us now. It's rearing its ugly head now. So we needed to look at ways in which we can work together with government and also with experts in the field of behavioral change, and also work with the Medical Research Council to come up with ways in which we can solve this problem together, because we don't have a solution on our own, but we feel that, with government, we definitely can come up with something that will help mitigate, the scourge of alcohol abuse and its harm.
Busi, just to come back to you, I'm quite surprised also that business was not consulted on these latest pronouncements coming from the presidency, especially as, at the weekend I read a story that business lobby groups and government were actually working closely together on tabling a plan to recover from COVID-19 long term. And from the story that I read, it seems as though there was some form of collaboration. So what then does that mean for, the long-term recovery plan, South Africa's long-term recovery plan, and the voice that business has in that?
I think broadly, if it actually sets the country back in a significant way, I don't know if it actually means anything in terms of the business-government relations in this country, because we do continue to engage on a number of issues. But I guess, our issue is that where it concerns business, these decisions can't be made unilaterally, because what they are doing is that they're actually giving prominence to the illicit industry, which is now going to booming, during this time. And I think when you look at the illicit industry booming, then you're also sitting with other health implications, right? Because that is a totally unregulated industry. You don't know how these people are producing their alcohol. You don't know what type of ingredients, that they are putting in this alcohol that will just actually make the health, so that will actually just worsen the health risk of the people that are actually going to be consuming it. I thought that we would have learned by banning the cigarettes to say that telling people to stop smoking, it doesn't mean that they're actually going to stop. It means that they just find other ways in terms of how they're actually going to get, cigarettes. So I don't think we have clearly learned. But then the interesting one for me is that the doctor is saying that the numbers that they are seeing at hospital have gone back to what they were before. So the issue, therefore, is less about the alcohol consumption having been worse during this time. It is a much more broad issue that we need to be addressing around responsible alcohol usage, because it means, this is an issue that South Africa is confronting, and I think we probably have to engage with how do we actually stop this notion of binge drinking. And I think, as like he has said, there are interventions that are put in place as an industry in terms of how they can actually address that. So shutting down an entire industry, with the consequent economic implications, is definitely not the right way to have gone.
And just, Dr. Weinberg, some final words from you, particularly as it does relate to this issue, but more broadly, the number of hospital beds that we are reading and we do understand are in scarce supply. In fact, reports that, some patients are actually even being turned away from hospitals because there is not enough capacity. At Baragwanath, how bad is the situation?
I think all hospitals in this country are currently struggling with the number of patients who are presenting with COVID, and everyone is trying to increase the capacity and increase the people to assist these patients. With regards to this particular topic, I think that yes, there is more than alcohol in this conversation. But if we can decrease the number of trauma patients during this time and use that capacity to help assist with the COVID patients, that would definitely make a difference in the long run. With regards to COVID, I think right now we are doing everything we can as a healthcare industry to create capacity for these patients. We are seeing huge numbers of patients, something that we've never seen before. And I think every hospital is struggling with the burden.